Hi, practice members. It's Dr. Dave Acosta. This is the week of April 13th, and I hope that you guys are staying healthy and happy and filled with gratitude. I've got 3 messages for you today, and the first one is gratitude. Gratitude is so important. I want to challenge you to think about 10 things that you're grateful for. One of the practices that I enjoy doing on the way to work, I have about a 25-minute drive. I count my blessings and I just use my fingers and I start to think about things that I'm grateful for. Well, guess what? That starts to put me in a mood that's a lot better. It keeps my mind from being idle or maybe going down a spiral that's going to put me maybe in a gloomier mood. So I want to challenge you to think of 10 things right now that you're grateful for. It could be your kids. It could be your house. It could be that you've got a comfortable bed. It could be that you have a friend to reach out or that has recently reached out to you. You know what those things are. So really just feel that gratitude as you're going through your list. Really make it real, okay? And that's really going to change your chemistry. It's really going to change your outlook on things today. So I challenge you on that one. The next one is on exercises. There have been so many posts on exercises and emails and such, but I don't know if all of my practice members and all of our patients have some basic concepts of how to move or some simple exercises. So I'll teach you a few right now. The first one is going to be just a simple calf raise, preferably done with bare feet without shoes on. That way you activate more of the muscles in the toes and the foot and all those bones. But it's just very simple, nice open stance, and then you just push up. Okay, and I challenge you to do 15, maybe 30 of those, maybe 45, just till it starts to burn. And you would think that the calf raise is a really simple exercise, and it is, but it's gonna really bring more blood flow into the lower extremities. It's gonna activate a portion of your brain that usually isn't activated if you're not using your calves, so it's actually really good for your brain. Movement, different body movement, different muscles in your arms, in your face, in your abdomen, in your shoulders, have a corresponding spot on the brain. So as you move and as you incorporate new movement, you actually activate portions of your brain that otherwise you might not activate. The second one is going to be a squat, and these are a little bit more difficult. But again, just start off with maybe 5. I say keep your weight on the heels. Hold the hands as a counterweight, maybe forward here, and then look up. Okay, 1, 2, 3. You get the message, but you're going to feel it in your thighs and in your glutes. You might even want to squeeze your glutes on the way up. But I tell you, you do 5 of those, it'll give you a shortness of breath. You do 10 of those, 20. I challenge you to do those, and then break them up into sets. Maybe do 5 repetitions, and then maybe do 3 sets, or maybe do 5 sets. But you'll find that once you start your body moving, it's going to cause momentum, and you're going to continue to move and exercise. So I really encourage you to do those. And then the last one, this one's a little bit more involved, but it's one of my favorite movements, and it's called the downward dog. So basically with the downward dog, you want to get on the floor, nice open hands like a starfish here, big hands. And then here you want to push your feet back to the earth. You want to see if you can get your heels down. I can't. But that's the idea, is to try to push the heels down to the floor. And then the idea is to try to push your torso and your head through your arms. Oh, that feels so good. Another thing about the downward dog is it gets you on the floor. And once you're on the floor, you can sit on your feet like this and wiggle and stretch out the ankles. You get more blood flow into the head again, activating certain portions of the brain that can in turn activate different organs, really help to balance hormones. So movement, exercise, yoga, toe raises, all very good. And then the last thing on our list here for today is we're open Tuesday, Wednesday, and Thursday. We are open in the morning and we are open in the afternoon. We're keeping everything super clean. We're wearing our masks. So I'm looking forward to seeing you. Please call Tamara for your appointment. But know that we're here Tuesday, Wednesday, and Thursday, morning and afternoon shifts. And it's going to be a pleasure to check your spine and to just give you that reset and reboot. So have a great week. See you guys soon.